Hello everyone. Today I'm not going to talk about any disease or any surgical option. I'm going to talk about post-prostate surgery symptoms and what do they really mean. So many patients, they return a few weeks to months after the prostate surgery and say, "Doctor, I thought I would be better by now. I'm still having leakage. I still feel that urgency or the burning. Is there something wrong?" This situation can be worrying, especially when the expectations are high. So in this video, I'll explain why symptoms can persist after prostate surgery, which symptoms are part of normal healing, which one needs attention, and how we as a urologist interpret the recovery timelines so that patients don't panic unnecessarily. I'm Dr. Shyam Varma, a robotic urologist and laser prostate surgeon. So let's come to the topic. Most important thing to understand is this. Persistent symptoms do not automatically mean surgical failure or complication. Recovery after prostate surgery is not linear. Some symptoms improve quickly, the others improve slowly, and some fluctuate before settling down. Understanding what is normal and what is not changes anxiety into confidence. So what persistent symptoms usually mean? When patient says symptoms persist, they often refer to urine leakage, urgency or frequency, burning during urination, weak control during activity, and the sexual changes. These symptoms usually reflect ongoing healing and adaptation and not damage. Body is still adjusting to a new urinary pathway, to a new ecosystem. So why recovery time varies between the patient? No two recoveries are identical. So the recovery depends on your age, the prostate size before surgery, the type of surgery you underwent, the muscle strength, the bladder health before surgery, and how consistent are you with the exercises. So comparing recovery with someone else often leads to an unnecessary worry and panic. Persistent urinary leakage. What it really means. Leakage is the most important persistent symptoms. Reasons leakage may persist include weak pelvic floor muscles, delayed muscle coordination, overactive bladder, and anxiety increasing the muscle tension. Importantly, most leakage improves over time, and even if progress feels slow, it will improve. Months of gradual improvement are common and very expected after the prostate surgery. Coming to the second important symptom is urgency and frequency after surgery. Some patients, they notice there's a sudden urge to urinate. There are frequent trips to the washroom and many times it's difficult to hold the urine and it leaks. This happens especially because the bladder was previously obstructed. It had become thickened and irritable. And after surgery, definitely it needs time to relearn the new ecosystem or the normal behavior of the bladder. This bladder retraining phase can take up to months or weeks most commonly. Coming to the third symptom, which is common, is burning or discomfort while passing urine. So mild burning or discomfort can persist due to healing of the surgical site. There's increased nerve sensitivity after the surgery and bladder irritation. This does not automatically mean infection. If urine tests are normal and symptoms are gradually improving, reassuring the patient is often that's needed. So finishing these three common symptoms, when the persistent symptoms need further evaluation is what you may be asking for. While patience is important, so you might be questioning, "Doctor, fine, I understand these three symptoms, but if the symptoms persist, how come I know I need a further evaluation?" So doctor reevaluate you if your symptoms worsen instead of improving. There's a new occurrence of symptoms. There's a severe pain. There's a heavy bleeding which occurred, or there are recurrent infection. So remember, you need to keep follow up with your treating doctor. And that's how we pick up and decide whether to reevaluate and do further investigation. Now coming to the role of pelvic floor, you may ask, "Doctor, is there any role of pelvic floor and bladder rehabilitation?" So I would say, persistent symptoms often improve with the targeted therapy, and the targeted therapy may include pelvic floor physiotherapy, the bladder training exercises. There are certain temporary medications we often give, and there are some lifestyle adjustments. Many patients improve significantly once the therapy is tailored to their symptoms. You may also ask, doctor, the imaging and the test are normal, but I have symptoms persisting. So why imaging and test may still be normal? Patients sometimes worry if symptoms persist, why are tests normal? This is because healing issue don't always show on scans. Muscle coordination problem don't appear on imaging, and the nerve sensitivity doesn't show on ultrasound. Normal tests often mean serious problems are ruled out and not the symptoms aren't treated. There are certain psychological factors that slows the recovery. Anxiety, stress, all this can increase your bladder sensitivity, they tighten the pelvic floor muscles and delay recovery. So reassurance and understanding are part of treatment and not an afterthought. There are certain things which I suggest patients stop doing. You should stop panicking, stop doing excessive research or self-testing, comparing the recovery timelines with others, ignoring exercises, and assuming it's a permanent damage. So what's the long-term outlook, doctor? The long-term outlook after prostate surgery is generally excellent. Most patients, they regain good bladder control, they resume the normal activities, and experience an improved quality of life. So persistent symptoms at a few weeks or months do not define the final outcome. Remember, the most important message here I want you to all carry is persistent symptoms after prostate surgery usually reflect ongoing healing and it's not a failure. Recovery takes time, so have patience and be under the guidance of your treating surgeon. Normal tests are reassuring definitely, and the gradual improvement is success.